This is optimizing your PI case outcomes, uncovering missed injuries to consistently build stronger cases. In PI cases, far too often, critical injuries go undetected or overlooked, leaving value and compensation on the table for your clients. Insurance carriers, well, they count on missed injuries or weak findings to minimize your outcomes. In this short presentation, I'm going to show you how uncovering these missed injuries can optimize your outcomes and consistently strengthen your cases. You already know that all injuries have value, and when they're not identified, there's missed opportunities for you and your clients. You also know that insurance carrier offers are decreasing and potentially forcing your cases into litigation. And you have limited pushback when you don't have clear, definitive, objective findings. You also know that fighting carrier causation and damages objections is a lot harder when you don't have clear, objective findings. And ultimately, your clients are not being diagnosed and compensated, but all of that can change very quickly. Now, just imagine if your cases had direct, indisputable medical evidence, such as on the left, the seatbelt contusion, on the right, the patella fracture, and underneath with the wrist fracture. Just imagine how easy these cases can be to potentially settle. Now, what happens if we have spinal ligament injuries? Spinal imaging diagnostics are important because every day providers are missing critical traumatic or PI-related injuries and the underlying pain generator. Patients and clients are getting misdiagnosed, underdiagnosed, and even undiagnosed. Why? Well, because providers are either not looking for this injury or they're using antiquated or insufficient technology. But all of that changes right now. Just a brief anatomy of the spinal ligaments. The spinal ligaments are important and they support movement within the spine, but they can get overstretched in trauma, leading to spinal instability, sometimes called pathology, or even sometimes called spinal ligament laxity. In fact, they're one of the most commonly missed injuries in trauma cases. It does take less force to injure a ligament than it does a spinal disc. And if you're wondering, is there a diagnosis for this? Well, yes, there is in the carrier evaluation software a diagnosis for both the cervical and the lumbar spinal ligament instability. Now, we already know that this is documented and supported, that the ligaments can get injured, that it's a significant injury. This comes from the AMA guides and multiple literature studies. The injury is also a significant claim value driver in PI cases. It has the potential for permanent impairment, which is one of the highest value drivers in the carrier software. And we also know that hyperextension can be proven to cause ligament damage, and hyperextension is what happens when a patient is involved in a motor vehicle crash. For you, it's important to know that this gets your cases out of the simple sprain-strain limitation that you may see quite often with the providers that you're currently working with. Now, the current technology that's out there either has significant issues or is just not able to accurately or consistently diagnose this injury. The MRI can't do it, the DMX can't do it, and the X-ray can't do it. And those are the three that you may be familiar with. MRI has no capacity for movement. In fact, the patient is encouraged to stay as still as possible. DMX has significant limitations. It can't even do the lumbar spine. And X-ray, the patient is free-form bending. And because of all of that, it really leads to inaccurate and inconsistent results. Not everything in a motor vehicle crash or a pain generator for a patient is the disc. Here's a direct quote from Mr. Jim Mathis, former superintendent for State Farm and senior staff adjuster, litigator, and attorney negotiator for Allstate. In the area of a disc injury, whether the patient has a bulge, prolapse, or herniation, the spinal ligament needs to be evaluated as well to help add to the case value. and to provide documentation, objective evidence, and causation of the disc injury. The ligament damage is a forever injury. It does need treatment. It requires treatment, both palliative and curative, but it is problematic for that patient, and I'll share that with you in just a little bit. Now, the technology that can identify this at the highest level possible is called Vertebral Motion Analysis, or VMA. It's already been featured on the Today Show, being called the technology of the future. The first time we can really see the spine move. And this technology is able to see and show the spine as a movie as opposed to a picture or even not at all. The patient flexes, bends forward, or extends, bends backward in the cervical and lumbar spine, and within those movements, we can identify instability at the highest level. You should also know that the technology has been FDA cleared, it's patented and proprietary and used specifically for spinal ligament instability since 2013. In fact, it was developed by spinal surgeons specifically to identify this injury. And it provides objective and quantified medical evidence. On the left-hand side, you see a snapshot of a patient throughout their movie, and you don't really see anything visually. In the middle is that exact same patient, now with markups placed on there after their testing, showing that there's instability or excessive motion of the spine, which is significant. And then on the right, the VMA can literally get down to the 0.5 millimeter in identifying this injury. 3.5 at C4, C5, and 3.6 at C3, C4. That's a significant injury for the patient and for the PI case and for the representing attorney. In fact, at those levels, those two are considered permanent impairment. That changes everything for your cases. It's also been called extremely valuable technology and the best way to demonstrate an instability lesion, much better than 2 to 3 x-rays. This resource, the AMA Guides to the Evaluation of Permanent Impairment, both the 5th and 6th edition, describe ligament instability and also have called it rare unless accompanied by trauma. This is a traumatically induced injury. It's not something that your clients are going to experience from sleeping on the couch or playing too much golf. This is a trauma-based injury and well documented in the AMA guides. And in fact, if we take a close look inside the AMA guides, on the left, we see that 3.5 millimeters of translation is a 25% whole person impairment. In the lumbar spine, 4.5 millimeters is a 20% impairment. This is significant. As I showed you earlier, that one patient had a 3.5 and a 3.6, and that's why it was a permanent impairment. The VMA has been shown to be accurate, objective, quantifiable, reliable, and consistent, which is significant when you're trying to identify and document and objectify lesions in personal injury cases. It's also been published in Spine Journal, and in fact won the Outstanding Paper runner-up. Here's another PI case that you might find interesting and probably have similar cases. This patient was actually a medical provider, an OBGYN, who had lower back pain and hip pain after a motor vehicle crash. And during her PI treatment, she received 3 MRIs because of her continuing pain. All of those MRIs were negative. Ultimately, that case had to settle, and it resulted in both a poor legal and clinical outcome. Even after this patient's case settled, with continuing pain, they went to get a lumbar VMA testing. And look at what it showed. At L3, L4, 4.3 millimeters. Not quite the level of permanency, but that doesn't matter. That's a significant injury. And then at L2 and L3, 4.0. If you look over in the far right column, over here, 9 millimeters is the disc height, and that's her worst ligament. So she could have received an MRI every day for the rest of her life, and it would never have identified this underlying pain generator. Unfortunately, it didn't get a six-figure outcome, not only from the liability, but the patient's own underlying underinsured wasn't able to be accessed. So not only was this patient left in chronic pain, but she didn't even get compensated. And I'm sure that there are multiple cases right now in your office that maybe have similar factors as well. In fact, here are a couple settlements that are involving spinal ligament instability, one for $225,000 and one for $875,000. Both of them, the defense labeled the injury as either soft tissue and initially offered $17,000, or they basically said it was unrelated and these were only soft tissue injuries. But once the client received the testing and it showed the underlying cause, this changed the outcome for both of these cases. When you send or have your clients go for this testing, there's multiple reports that will eventually come to you. On the left is the raw data. In the center is the written report, very similar to a report that's generated after an MRI. Plus, you'll also have access to the video as well that you can show the claims adjuster, defense attorney, judge, jury, mediator, arbitrator. Also important to note that each of these tests are read, verified, and validated by an outside independent neuroradiologist to make sure that everything is correct. Here's another excerpt from my interview with James Mathis. Without the ligament injuries, disc injuries are all going to be discounted in Colossus, Teach, Injury IQ, and Decision Point software. All the software is going to discount the disc because you don't have the ligament injury objectified to support the disc. It can be discounted up to 70%. They're going to argue the disc is pre-existing. I think it's pretty basic. All of this is being missed in the demands and medical reports that I see. The VMA provides an objective, defensible diagnosis of ligament injury and the injury severity so cases can settle between 90 to 120 days from the date of the accident for policy limits. And that's one of the benefits for you and for the providers that you work with to refer for this particular testing. Long term, your clients are going to have significant consequences. Ligaments heal poorly, and they heal with scar tissue because of the poor blood supply. This is going to leave them predisposed to re-injury. They're going to have a chronic spinal weakness and instability in that area. They may have accelerated spinal degeneration. They also have the potential for adjacent segment disease, which is well documented in the literature as what happens to the spine over time. The possible permanent injury, which we discussed, and life care planning and future medical or future care expenses can be included in the demand package. Essentially, your client's spine is going to be unable to tolerate even lower forces and loading of the spine with this injury. The benefits for your clients is that this helps to get your cases out of simple sprain strain. This is more than a simple sprain strain. This is literally a tearing of the ligaments of the spine that has been objectified and quantified. Other technology is not as accurate. This is missed by a majority of the PI treating providers, and I'm sure it's being missed by the providers that you work with. All injuries have value, and when you don't identify this injury, your claims are not going to be as valuable or optimized. You can document a client's damages claim. You can create a link to the client's crash because of the traumatic nature of this injury, create liability policy limits, and can open other recovery sources. Whether your client has a positive or a negative MRI, a VMA is a test that should be included as part of the patient's workup. What are your next steps and opportunities for your clients, for your cases, and the providers that you work with? It should be utilized in all cases in order to capture the missing injuries. It can help obtain policy limits on cases and open up UIM. You can discuss VMA with your current treating providers and encourage them to look for this injury and to refer for this testing. And it can help with your difficult or lowball or negative MRI cases. Identify those cases and think about why is the patient continuing to have symptoms, or why was there a negative MRI and the patient is still complaining because something may have been missed. Ultimately, this is going to optimize your case outcomes so you never miss client injuries again. Thanks for your time. Thank you for watching, and please follow up with the provider who sent you this video.